है, फास्ट किया है, एंड देन यू हैव टेकन योर ब्लड एंड गिवन टू लेबोरेटरी में आपका इफ it is between 100 and 126 mg/dl, they are referred to as impaired fasting glucose or pre-diabetic. But if it is less than 100, then no diabetes, and if it is more than 126, then you have diabetes, pre-diabetes and normal person. Then oral glucose tolerance test, like then you have to consume quantity of the glucose, wait for 2 hours so that the sugar or the glucose comes into the blood stream, and then you have to measure again. So now this is a time between consuming of glucose or having meal and removing of blood. ये 2 घंटा होना होता है. Normally what happens is, what mistake we do is, isn't it? 8 o'clock I have given one blood sample, I feel it is fasting blood sugar, isn't it? And then घर पे आने को मुझे 1 घंटा लगता है. Then I take breakfast and immediately I start. 10 बजे मैं वापस जाके ब्लड शुगर देता हूँ. तो आई एम गिविंग दिस ब्लड शुगर आफ्टर 1 hour ओनली, बिकॉज खाया मैंने 1 घंटे के बाद और 1 घंटे के बाद में दिया. तो नो, दैट विल नॉट शो यू द प्रॉपर दिस थिंग, रिजल्ट विल बी नॉट प्रॉपर. सो यू हैव टू वेट फॉर 2 hours. ओके, द टेस्ट इज यूज मोर फॉर टाइप 2 डायबिटीज. एंड रैंडम ब्लड शुगर इज एनी टाइम ऑफ द डे. पेशेंट आ गया, इसको ब्लड विजन होता है, उसका हमने ग्लूकोज निकाला, देखा कम है या ज्यादा है. That is random, any time of the day. No relation is. Deciliter. Okay. Now these are medical terms, so we don't have to worry for. We have to worry for, see, 100, 126. Yes. Okay. Level, we have to worry for level. So persons with diabetes need to have their hemoglobin A1C. Hemoglobin A1C. Every 3 to 6 months. Now see, what happens is, अभी मैंने शुगर खा लिया, थोड़ी देर में शुगर बढ़ जाएगी, isn't it? But हीमोग्लोबिन के अंदर कुछ एक ऐसा एंजाइम है जो इसका रिकॉर्ड रखता है, and we are really lucky enough to know that ये एंजाइम हमको 3 से 6 महीने में हमारा ब्लड शुगर कितना रहा है उसके वो मालूम हो जाता है. So that is very important this thing, investigation, and which helps you to know whether you are suffering from diabetes at high level. High level तुम्हारा रहता है या low level रहता है. That can be known from this hemoglobin A1C. It is very helpful way to determine how well treatment is working. You can know from this level how the treatment is working on. Now the treatment. Immediate goals are to treat diabetic ketosis. Very dangerous symptom, diabetes. Diabetes ketosis, diabetes hepatitis, then hepatic coma, diabetic hepatic coma. These are all dangerous. Okay, these are all complications of this disease. तो समझ में नहीं आता डिजीज क्या है करके, बट ये डिजीज पूरे ऑर्गन्स को फेल करता है, पूरे ऑर्गन्स, राइट फ्रॉम ब्रेन, आईज, डायबिटिक रेटाइनोपैथी जिसको बोलते हैं, डायबिटिक एंसेफेलोपैथी, डायबिटिक रेटाइनोपैथी, डायबिटिक न्यूराइटिस जिसके अंदर सब अंग में झुंझुनाहट हो जाती है, देन हिपेटोडायबिटिक, डायबिटिक की वजह से लीवर जो है वो वीक हो जाता है, देन डायबिटिक किडनी जो है वो उसके ऊपर असर हो जाता है. एवरी ऑर्गन इज फेल्ड बिकॉज ऑफ डायबिटीज. बिकॉज टाइप prevent diabetes related complications such as blindness, heart disease, kidney failure. Now, why we have to maintain our blood sugar? Because we have to see that our this important organs are not affected, isn't it? Otherwise there is no other symptoms. कुछ ऐसा पेन नहीं होता है, कुछ हमको इरिटेशन नहीं होता है, कुछ हमको तकलीफ नहीं होती, ज्यादा पानी पीना, ज्यादा पेशाब करना, ज्यादा खाना खाना, okay, कभी ऐसा चक्कर आ जाती है. बट we have to see that our eyes, hearts, kidney, brain, they are not destroyed by diabetes. These goals are accomplished through blood pressure and cholesterol को control रखना पड़ेगा. This is very important. See, I have told you how to manage natural management of diabetes. Now, natural management of diabetes means you are not managing diabetes directly, but you are managing other factors. So the first very important thing, if you are diabetic and you have more high blood pressure, see that your high blood pressure is also controlled. so that your diabetes is not affected, so that your other organs are not affected. Then careful self-testing of blood glucose level. When you are self-testing, you should see that, as I said, 2 hours, you should be very careful about 2 hours, because you may record a wrong thing, wrong levels also. So you have to be very particular. When you take your self-testing blood glucose level, you have to know that you are going to collect the blood. PP blood should be collected only after 2 hours of consuming either meal or consuming glucose. You have to read the books also, get educated. Exercise, very important. Why exercise is very important, I will discuss with you. Then you have to take care of your food. Food care is very important for diabetes, because food amputation of food, 80% of the amputation of the food is because of diabetes. Now why because of diabetes? Because जब मार लगता है तो you lose the sense also. Encephalopathy तो neuritis हो जाता है उसमें, you lose the sense also. तो कट गया है, हो गया है, you don't come to know unless it is infected or unless it is necrosed. You don't care also, because उसमें पेन नहीं होता है. पेन नहीं होता तो you don't care. And finally, the patient need to ampute that part. Meal planning and weight control. Again, weight control is very important. If diabetes hai, and if you don't control your weight, you may end up with all complications. Medication is the last thing. See, management mein medication is the last thing actually. Okay? Or insulin, whatever it is. You have to take medication, but you have to take care of all these things. It's very, very important. There is no cure for diabetes. So don't rush to the doctors. किसने बोला कुछ कमाल हो गया डायबिटीज, उसके पास मैंने दवा लाया, खाया, वो डायबिटीज पूरा अच्छा हो गया. Okay. The only slide in red color. Okay. The only slide in red color. There is no cure for diabetes. Treatment involves medication, diet and exercise. Medication, diet and exercise. Medicine हमको लेना है, डाइट हमको कंट्रोल करना है, एक्सरसाइज हमको करना है, टू कंट्रोल ब्लड शुगर एंड प्रिवेंट सिम्टम्स. These are this thing, what to eat now. What to eat. See, carbohydrate, what is carbohydrate? Carbohydrate is direct sugar, you can see. Carbohydrate हमको काय में मिलता है? शुगर में कार्बोहाइड्रेट मिलता है. That is, carbohydrate is sugar. Potato में carbohydrate. So you can say carbohydrate means sugar. Okay. It is not that you cannot consume sugar or you cannot consume rice, potato. You have to consume rice, sugar, because brain works only when it is supplied with sugar. Brain works only with it when you supply with sugar. Agar sugar nahi hoga to brain will not, because every second it needs energy. So glucose is what is going to convert into fuel, energy. Uske baad energy. Second step is energy. Okay. So glucose has to be supplied to the brain, but in a very measured way. In a very measured way. So what first, I have written is provide to learn how much fat you should take, how much protein you should take, and lastly how much carbohydrate you should take. Okay? You need in your diet a registered dietitian. You can go to the dietitian and take your this thing also, diet plan also. People with type 1 diabetes should eat at about see, this is very important. Same time, if you are taking your breakfast at 8 o'clock, take your breakfast at 8 o'clock. Your lunch at 1:30. Regularly take your lunch at 1:30. Your dinner at 8 o'clock, again in the evening. Be regular there. Okay. Whatever happens to you, but you are going to take your dinner at 8 o'clock. So what happens is, body is in order now. Whatever I said initially, disorder nahi hona chahiye. Disorder hai, ye disease disorder hai. So now we have to put our body into order. Breakfast आपने एक टाइम पे ले लिया, लंच आपने एक टाइम पे ले लिया, डिनर आपने एक टाइम पे लिया। अब बीच में अगर आपको कुछ ठंडा कोई पिलाता है, सॉरी बॉस, माई बॉडी डजंट अलाउ। कोई आपको नहीं बोलेगा, यू से टेल हिम मेरे को डायबिटीज बहुत हो गया करके। आपका फ्रेंड फोर्स करेगा? नहीं करेगा कोई। सामने केक आ गया, बर्थडे में गए आप, केक आ गया, 8 बजे का टाइम है, खाओ, ओके, आप दूसरा अपना डिनर मत लो, इट केक, नो प्रॉब्लम। डिनर की जगह पे आपने केक खा लिया, तो केक भी खाने का और डिनर भी खाने का, इन बिटवीन भी खाने का, शुगर मैनेज नहीं होगा। So same time is very important, and try to be consistent with the types of food you choose. Okay, this helps to prevent blood sugar from becoming extremely high or low. जब आप टाइम पे रखोगे तो अचानक नहीं बढ़ेगा। See what happens is, suppose अभी मैं डिसऑर्डर, मेरा बॉडी डिसऑर्डर है, एंड ब्रेकफास्ट टाइम पे ले रहा हूँ, लंच टाइम पे ले रहा हूँ, डिनर टाइम पे ले रहा हूँ, इन बिटवीन किसी ने एक कोक पिला दिया, कोक इज फुल ऑफ शुगर, शूट अप होगा कि नहीं? शूट अप होगा, मेरा शुगर शूट अप होगा, पूरे ब्लड में शुगर रहेगा मेरा, so it is going to harm me. So timetable is very important. How to take medicine? Medication to treat diabetes include insulin and glucose lowering pills called oral hypoglycemic drugs. Oral means when you take from mouth. Oral. Hypo means low. Hypoglycemic, glucose को लो करने वाला pills. Okay? It is not insulin. वो खाली ग्लूकोज को लो करता है. So many time what happens is 10 days I take the proper treatment. तब बराबर गोली वोली खा लिया and I check my blood. It is normal, 80 हो गया, खलास. I'm happy. But मैंने आपको क्या बताया? The disease is long lifelong. The disease is lifelong. 8 दिन में आपका इलाज नहीं होने वाला. रेड स्लाइड मैंने बताया आपको. There is no cure. Whatever we are going to do, we are going to manage our blood sugar. Bas, that's all. And we need to manage our blood sugar till the last moment of our life so that we don't spoil our vital organs. Vital organs को हमको सेव करने का है, तो हमको ये सब काम करना पड़ेगा. Okay?